Tumefurahi sana. Tulikuwa tumekauka sana kwa ajili ya maji. Hapa tumepata shida ya maji sana.
Sinataka kilima na wakaboka kundi yote asaidia watoto wetu. Sisi nacheka kabisa. Afurahia mpaka mbinguni.
Turkana County, the cradle of mankind, is the largest county in Kenya, covering an area of 68,000 square kilometers. This represents 12% of Kenya's total land mass. Despite having such a massive virgin land, only 30% of it is viable for agriculture. With a growing population of close to 1 million, Turkana County is classified as an arid and semi-arid land, receiving average rainfall of 200 millimeters annually and with a daily average temperature of 30 degrees Celsius. Such extreme climatic conditions make the area water-stressed, contributing to drought, hunger, and severe malnutrition. Meet James Kidor, a father of 7 and a farmer from Kangeriga village in Turkana County. James has faced many cycles of hunger and famine over the past years. However, 2019 is a year he will never forget.
Wakati ilikuwa ni wakati mbaya sana ambaye ilifanya mimi ningetoka Turkana County. Sababu niliona Turkana County kama imelaaniwa, hakuna mvua. Niende nitafute mahali chakula hivi. Mimi nikaona sasa mimi hapa sina tena kitu kingine ambacho nafanya.
We have issues of chronic food securities in Turkana. We have poor access to safe water, and also we have issues of poor hygiene.
Surviving in this side of the world is sometimes very difficult, with the most vulnerable being the elderly, women and children. From a remote village in Katilu ward, we meet Dorcas Araga, a mother of 5, who, like most of her neighbors, could only afford 1 meal a day to raise her large family.
Wanakula jioni saa hii, alafu tena ikifika tena kesho jioni.
In a community highly dependent on pastoralism, periodic cycles of famine and hunger have been a major threat, leading to malnutrition and great human suffering.
This is more of a pastoral community, or a community that is relying mostly on animals, that they have had challenges in terms of drought, some of them dying, others driven by other communities that are living adjacent to them because of the issue of cattle rustling.
According to the Turkana County 2019 SMART survey, an annual survey intended to assess the county's performance on health and nutrition, 3 out of every 5 children between the age of 2 and 5 years access only 1 meal a day, with 2 out of 5 breastfeeding mothers feeding irregularly or have no meal in a day.
The level of malnutrition in the pregnant and lactating mothers, children below 5 years, they really suffer from malnutrition, whereby we find that the GAM rate, the survey which was done in 2019, put Turkana as a county above 26%, which is above the normal rate.
According to the World Health Organization, this is a health emergency. Over the years, relief food donation from the government and NGOs have been used as an intervention to solve the hunger and malnutrition distress in Turkana County, a move that has had limited impact. Keen to improve the livelihoods of the people of Turkana and as a way of corporate social responsibility, Bayer provided a $5 million fund towards a sustainable, lasting solution. Key focus areas being the Turkwel and Katilu wards in Turkana County. This is what led to the birth of the Impact Project, an improved approach to community-based nutrition in Turkana County, implemented by PanAfricare, a non-governmental organization transforming livelihoods in Africa.
key for us, of course, is to find the balance between farmer, consumer health and crop science. And in crop science, we're really talking about smallholder farmers and how to make smallholder farmers a growth engine of Africa's economy. We're having a strategy on smallholder farmers that really helps us to empower them to become more, a higher adopter of technology in order to improve livelihoods and at the end also improve the sustainability of food supply.
We have developed some global sustainability objective, which is to improve livelihood of a small farmholder around the world, nearly 100 million by the year 2030, but as well to give access and to improve the nutrition of the same around 100 million people in the, let's say, developing countries.
Bayer is a global life science company, that focuses on providing solutions within the life sciences. Our vision is health for all and hunger for none, and that is to essentially say that all we do is all about creating and enabling a world where health for all and hunger for none is a possibility. That yes, we are a company that does business, but in addition to that, we are also very keen to work and empower the communities. And we do that through two main sub-arms, I would call that, and that is through the Bayer Fund and through the Bayer Cares Foundations.
Impact program is a program that is well funded by Bayer Fund. It's a well documented partnership between us and Bayer Fund. And as PanAfricare, we really want to say a big thank you to Bayer Fund for funding this mission.
Through the program, Bayer aims to empower the communities to rehabilitate unproductive lands, gain access to clean water, and ultimately grow their own nutritious foods through diverse capacity building, infrastructural development, and behavior change interventions in a period of 5 years.
Meaning to give a chance to the farmer to produce more vegetables and to have a bit more balanced nutrition basket for those people to be able to have a better, let's say, nutrition components.
Following the successful unveiling of the Impact Program on October 3rd, 2019, there has been an improved access to quality health services and increased knowledge for prevention and treatment of malnutrition.
On behalf of my government, we've been gathered here to launch the Impact Program, which is basically a nutritional 5-year nutrition program.
We believe that being a big corporation, investing heavily in research and development over the years.
This is through capacity building of community care groups, offering training to targeted community health volunteers, community health extension workers, nutritionists, and nutrition outreach agents. Meet Ilequer Irene, a community health extension worker at Lopur Dispensary in Katilu Ward. Irene's work is to sensitize her community on better health and nutrition, her key target being pregnant women and lactating mothers.
Ile tabia ya awali yenye watu walikuwa nayo imebadilika. Watu wamebadilika saizi. Yaani wamejua hata saizi mama mjamzito anajua ni chakula gani yeye anafaa kukula. Mama mwenye ako na mtoto mdogo anafaa kujua huyu mtoto mdogo wangu amefika 6 months. Ninafaa kuintroduce kwa chakula na ninaanzia nini kumpea huyu mtoto kwa sababu huyo mtoto hajakuwa stable kwa chakula.
The concept of training care groups and trickling down knowledge to the lead mothers, directly impacting the community at the household level, is a concept well integrated in the Impact project.
The objectives of this program is to impact health and nutrition for women, lactating women, and pregnant women, and children under 5 years in Turkana County within 5 years.
Like we have seen and like we'll continue to see, is really focusing on the area of nutrition, the area within agriculture, and making sure that people are empowered, people are trained to be able to grow the right food, to be able to reclaim lands that previously were not productive, and that they are also trained to know that they can do a few things, to be able to utilize available technologies, to be able to utilize available resources to grow their own food. And not just food, because you're talking about empowering them, but nutritious food.
Based on the 2019 SMART survey, 75% of women in Turkana County were consuming food from less than the 5 out of 10 food groups.
When we did the baseline survey, most of the households here were consuming less than 2 food groups per day. So we want to get that to at least the minimum number of 5.
With dietary diversity, the narrative changes. We don't say carbohydrates. We are saying energy-giving foods, or we're talking about starchy foods, or we're talking about cereals as a food group. We're talking about beans, legumes as a food group. We're talking about nuts as a food group. We're talking about milk as a food group. We talk in a way that consumers can understand, that farmers can, that women in the village can understand.
To overcome this challenge, home vegetable gardens were established through the Impact Program, benefiting over 600 households who have now access to diversified diets from their kitchen gardens. To ease the movement of the community health volunteers, bicycles and motorbikes were provided to link the community and health facilities, strengthening the community-level health services.
In terms of improving access to healthcare, which is a universal healthcare concept that was driven by WHO and even the government of Kenya, among the presidential 4 agendas, we've got a vehicle that is supporting the activities. We've also had outreaches targeting communities, hard-to-reach areas where there are no facilities.
Before then, the rate of malnutrition was very much high before the intervention, before the Africa comes in. But of late, the situation has improved because very many interventions were put in place to help mitigate the situation in terms of malnutrition.
The government is supporting this project by implementing also issues of multi-stakeholders meetings, that we want to bring all the stakeholders together in order to support issues of malnutrition.
We work very closely with the Minister of Health and Minister of Agriculture, even in terms of policy formulation and strategy development. We really support, we want to work with them to make sure that system are strengthened so that when we are leaving, then the system are on the ground.
Another strength is the way it was integrated. You know, we're talking about farmers here, but we're also talking about health workers here. We are talking about community health volunteers here. So you're integrating nutrition and health with production, with the communities, what communities are producing and all that. So farmers are producing nutritious food. The health care system, of course, through the community health workers and other stakeholders, are strengthening, you know, the health aspects of food, which is likely to give us more resource than if we just, you know, touch it with one direction.
In an effort to provide a blueprint of how nutrition interventions in the county should be implemented, PanAfricare, through the Bayer Fund, provided technical and financial support towards development of the 2019-2023 Turkana County Nutrition Action Plan. The Impact Program also equipped farmers with good agricultural practice trainings to increase household access, availability and consumption of diversified and nutrient-rich food. In a region highly dependent on pastoralism for livelihood, Sarah Emase, a widow and orphan, had no cattle, sheep or goats to support her livelihood. But thanks to the Impact Program that assisted her to clear her land and access clean seeds for farming.
Hii shamba alikuwa anakaa tu kama msituni tu. Hiyo kampuni vile alikuja ndio alisaidia sisi. Sababu mimi hakuna mtu ya kutegemea. Nilikuwa nategemea hii shamba. Sababu hata mzee yangu hakuna. Wazazi hakuna. Hii shamba tu ndio mambo yangu yote.
With only 30% of Turkana County being viable for agricultural practices, water has been a major hindrance to smallholder farmers who work individually or in groups. The Impact Program has improved irrigation and infrastructure through canals, as well as constructing and rehabilitating water points. The program has also expanded irrigation capacity in beneficiary farms. In a community where land is primarily owned by men, Margaret Mejeng and her fellow women recall how getting farming land was difficult.
Nakataa kwa sisi mama alia kamsee, sisi kama Mungu naleta hiyo shamba, sisi nakataa hizi namna gani? Sisi nataka kilima na wakaboka kundi yote asaidia watoto wetu.
Having overcome the farmland acquisition challenge, Margaret and her colleagues had another obstacle: water. A resource that Impact Program provided through drilling of boreholes, subsequently nourishing their vegetable farms.
Sisi nafurahi kama angalia maji. Sisi nasema kama hii maji kutoa hapo, sisi nafurahi kabisa. Sisi nawaka nguvu. Hata watoto wetu kukula. Hata mgeni yetu kukula. Hata sisi kwanza. Nafurahi kwa hiyo maji ile yanakuja saa hii.
James Kidor also narrates how his thirst for water was quenched by a borehole that feeds 2 large water tanks near him. His farm became more productive due to easy access of water.
Sisi tumefaidika kwa sababu hata maji ya kukunywa tunakunywa hapa. Mimi jambo la kwanza sinunui mboga. Ile pesa ambayo nilikuwa ningetumia kwenda kununua mboga, hiyo pesa natumia kufanyia kazi nyingine. Kununulia mtoto kalamu, kununua kitabu, kununua sabuni. Mambo hii yote, faida hii yote ni kutokana na Biofund.
Lack of assorted farming tools has been a stumbling block to the farmers, some depending on traditional sticks to dig and plant. To overcome this, the Impact Program distributed assorted tools to a total of 690 households, enhancing farmers' successful and sustainable food production in Turkwel and Katilu wards. In full realization of some farms experiencing poor crop production due to ineffective irrigation infrastructure, the Impact Program supported improvement of water structures at Israel, Lishebora and Green Angels by providing pipes in order to expand irrigation capacity. Through the Impact Program, farmers in Israel Farm have been able to grow maize, vegetables, watermelon and other assorted crops which they sell in the neighboring markets.
Kwa sasa hivi, tunapopanda chakula kama hii, tutafuna na tupeleka nyumbani.
In the 2 years of implementing the Impact Program, individual and group farmers in Turkwel and Katilu wards have increased their agricultural productivity. The Impact Program has also brought a mindset change to the residents from dependence on pastoralism to agro-pastoralism.
I'm seeing a future that a Turkana man who has been, his livelihood was hunting and gathering, producing food.
With the design of the Impact project, you can see sustainability in it. For example, if you are a farmer and you're shown how to farm, you see, even after the project is over, no one can get that knowledge out of you. I mean, you remain with the knowledge and you can practice it, and another farmer can see what you're doing and borrow ideas like that. And it is always good to think of sustainability when designing and implementing projects.
As both Turkwel and Katilu wards residents dance to the success of the Impact Program, they have a reason to smile for better health, reduced malnutrition, and financial empowerment of communities. This underscoring yet again Bayer's commitment to advancing life for the better, especially for the most undeserving communities. As James and other farmers enjoy a close support from the Impact Program, the farmers have experienced some challenges along the way, requesting for intervention in the remaining 3 years of the program. Transportation is a challenge cited among the farmers, hampering quick access to the market. The effects of the COVID-19 outbreak have continued to be felt, posing a challenge in the implementation of the project. However, Bayer, in partnership with the implementing partner PanAfricare, is optimistic that the remaining 3 years more success will be recorded.
By empowering people, and specifically smallholder farmers, this is not only relevant for growing the farmers, but it's growing communities, growing countries, and of course make the production of affordable food to communities at the center of what we do. Smallholder farmers for us also is a growth opportunity, because by empowering smallholder farmers to adopt new technology, we will see that this adoption leads to an improvement of productivity and improvement of food supply.
And we are in the process now to significantly increase our activity in Africa, investing in some new country, new businesses, and that's why we have decided as well to increase our activity in the charitable area, because it is a kind of fully integrated approach as we have as a company, and we strongly believe that this is something we have to do right now if we want to be successful in the next 5, 10, 15 and 20 years in Africa.
We've been able to achieve so much success in a space of just 2 years. So for the next 3 years, I'm sure this community is going to be significantly impacted. We would like to recognize the contribution of our partners, PanAfricare, the county government of Turkana, the local community. They've been phenomenal in terms of bringing their ideas, synthesizing them with Bayer in order to achieve this ambitious objective.
Turkana County's vision to provide opportunities for nutritious food, water security, good health and well-being is coming into reality as the Bayer-funded Impact Program continues to support quality health services and increased knowledge for prevention and treatment of malnutrition.
From the data we are receiving the monthly service data from the facilities, and we look at the number of children attending the child welfare clinic who are underweight, the level has come down.
During the 2 years of implementation, Bayer has realized its goal of improving the lives of pregnant and lactating mothers, infants and young children in Turkana County, and looks forward to better the program in the next phases. To the local farmers in Katilu and Turkwal wards, this is truly a dream come true. Producing diverse foods in such a dry place is something they never thought of. At the heart of Bayer's commitment to society is the passion and action towards supporting people and communities to live a quality life. The Bayer-supported Impact Program is the first of its kind for the Africa region, with an objective to implement signature programs in selected geographies to enhance lives and livelihoods. Through partnerships and community empowerment programs with both public and private sectors, Bayer is truly living its vision of creating a world where health for all and hunger for none is a possibility, transforming lives and building a brighter future for Africa and the world at large.